Hi, welcome back. This is Sarah Rooney with Visiting Nurses Hospice. Here's our next training. We're going to be focusing on family dynamics and boundaries. Of course, you'll be not just serving the patient, but actually serving the family. And sometimes those situations may be a little challenging or may challenge some of your own worldviews. And then how to set up your boundaries for yourself to keep a professional distance so that you don't have burnout. Okay, well, it's very brief. An introduction to our families. Like all of us, we're all unique, we're all different, and you will be finding that there'll be a variety of families you come in contact with. Knowing that they are going to respond to terminal illness in various ways, and sometimes things can get a bit rough if families already have a dysfunctional or difficult family situation. Some of that is aggravated by terminal illness, and so you may see some family behaviors escalate. But also, some are very accepting, very peaceful, very funny, and very much welcome you into their home. They all handle it differently. Some may seem very confident and calm, while others express anger and confusion. This experience can bring families together, but it can also tear them apart, and you will be a witness to some of these situations. Boundaries. We talk about boundaries because they're very important. They help you clarify your responsibilities, and it also clarifies the expectations for you, but also the hospice family. When a new volunteer is set with a hospice family, we do take them through the volunteer responsibilities and what they are and are not allowed to do. They're designed to decrease your liability and also keep you safe. And we also want to protect you from burnout, not taking on too much, not giving too much, not becoming a martyr to your patients. And these emotional boundaries will always preserve the working relationship. So here's some basic sort of challenging situations we'll just sort of go through. I have to say, most of your visits with families and your experiences with families will be very positive. But there will just be some that you find a little challenging and perhaps a little uncomfortable. And again, I always let my volunteers know that if those situations they find are too difficult for them, that they should give me a ring and let me know, and we'll try to find a new placement. Not every family is the right family for a volunteer. So oftentimes, I think kind of the biggest one is families will just share a lot of personal information. They may be overly open. What do we say? TMI, too much information. And that can even get into gossiping and wanting you to take sides or talking about a family member, like maybe even if they're in the next room. You need to be very careful not to take sides and to stay out of it. And one of the ways is just to acknowledge their concern and their frustration. Oh, I can see you're very upset. Oh, I can see how that would frustrate you. Yeah, I would be angry too. Comments like that should be fine, to acknowledge what they're feeling, but then don't get pulled into the gossip and taking sides role. A lot of families have a different opinion regarding hospice. Some of them may want to treat the patient, and then others may decide that hospice is good. Some of them could have anger over the primary caregiver. Sometimes the patient is angry about the primary caregiver. This can go into just sharing a lot of personal information, but there might be those tensions regarding family members and the treatment of the patient. Who's helping, who isn't, who's not stepping up to the plate. Again, you're just going to acknowledge their position. You remind them, if you feel like you're getting pulled into that you're just a volunteer and you can't really give any advice if they're seeking it, and to encourage them to talk to their nurse and social worker if it's getting really some heightened emotions there. But really, a lot of times it's just, viewing their position and letting them know, oh, yes, I can see how you feel that way. Tension in the home. Typically, the homes we put you in are not going to have a lot of arguing or yelling or violence or anything like that, but there can be tensions. You can have the caregiver is very angry. Maybe they're stuck in bed and they're tired of telling somebody to get them things because they can't do it for themselves, the frustration of just being sedentary. The caregiver is burned out and they're getting tired of the patient who won't do, what they want them to do, things of that sort, and they might just be a yelling home. Really, some of this you're just going to have to accept. It may seem a little uncomfortable for you. Your family may not interact like that. Always in these situations, if arguments start to occur, just turn your attention to the patient. Take time to focus on them. You can maybe even point out, if it feels comfortable to you, to let them know, hey, I think your dad or the patient seems to be getting upset. because everybody's arguing. I can tell he looks really upset, and maybe this can redirect them, but sometimes you're just going to have to kind of work your way through it. If you're really concerned, though, for the patient, or you're concerned about your own personal safety in any of these situations, you just contact hospice and let us know. Another challenging situation may just be that the home's not clean. I would say that's a pretty typical one. Either you've got someone who smokes a lot or smokes while you're there. It's a dirty home, or a home where someone has a lot of clutter. They may have animals or several animals or barking dogs. As a volunteer coordinator, I do my best to know what your limits are around that. I know some people are very much allergic to smoke, and some can handle it for short situations. Some people don't like animals or are allergic to certain animals. So if you have preferences that way, you just need to let me know. You need to know your limits regarding cleanliness. And like I said, I'll usually advise you before the visit, but it doesn't always happen. Sometimes I don't know. And if you find yourself in a situation you're not comfortable with regarding cleanliness or animals, you just need to let me know. Also, occasionally the expectations on the family's part, for the most part, will be unrealistic. Despite our conversations with them on the volunteer role and what they're able and not able to do, they either aren't listening or they're too worried at the time. It doesn't really get into their memory, and they'll be asking you to provide the kind of assistance that really only a paid caregiver or staff should provide. Examples might be, you helping them go to the bathroom and needing a lot of help in there, or asking for your medical advice, or maybe there's, can you stay longer, or they're not coming home on time, or they're asking you if you can make another visit at another time. So you just need to be aware of that, that it can happen. And if you feel you're being misunderstood your role, or you're being asked to do things that don't seem part of your volunteer responsibility, you just need to let me know. If they ask you a question, you could say, I'm supposed to check with the volunteer coordinator, and then she'll get back to you, and just leave that in my court and I'll deal with it. It's also good to remember that sometimes it's your expectations that are unrealistic. If you really think a patient you've been placed with is not a good match for you, you just need to let me know. Sometimes we have high hopes for all our placements, and we do have those beautiful moments with patients and families where we connect deeply with them. But there are also challenging situations that may in some ways seem less fulfilling, but if you're willing to be flexible about that, that's the best, but totally understand if it's not the right family for you. Here's a few examples of boundary dilemmas. I'm just going to read them to you. June and Bob, they're frequently arguing and accuse one another of not caring for the patient. They're frequently unable to pay their bills and no longer have a working vehicle, and it's winter, and their gas will be shut off, and they do not pay if they don't pay their bill. So they ask you for some money, or maybe can they take them places, or can you run some errands for them? So we consider this an appropriate gifts boundary. There may be a little bit of a situation where you might be able to run an errand, or say, hey, why don't I stay here while you run an errand, or can you call a friend? But typically you should not be paying bills, offering money, trying to loan your vehicle. It may break your heart, but you need to let them know, talk to your social worker, and oftentimes they can put them in touch with other services that can help them with these things. Oftentimes a family has been functioning a certain way for a long time, and what may seem like a desperate situation to you can be something that they've been living with and like for a long time. So always make sure to refer them to their social worker or nurse for social needs. Another one, a hospice volunteer becomes very involved with a family. Some of them you will just really adore, and you will feel like you've become, part of their family. So the volunteer gives them their phone number, and he visits several times a week, sometimes beyond what the volunteer request is, hasn't let the hospice staff know, and the family starts calling the volunteer during crises, maybe in the middle of the night, in hopes the volunteer can come over, or is making requests of them by phone. So this is an example of when not to give your phone number. In the beginning, we ask that you don't give it to them. Clearly, when you're making a call and it shows up on their voicemail, they may use it, but typically I ask families to go through me, certainly in the beginning, regarding scheduling or scheduling changes. because you don't want to get overly involved. Again, this is the job of the social worker, and if you try to fill that role, then it kind of splits their care, and it makes it so that they're not getting good hospice services, and it makes it so that the staff are not involved and are not knowing what's going on. So be very careful not to become over involved and try to fix things and be their counselor and their social worker. Setting boundaries. These are some basic ones that we'll just read through. So here's a brief basic list of boundaries. Don't accept a patient's offer for financial help or vice versa. Don't accept big gifts of appreciation. It's fine on occasion to bring a card or some cookies, or maybe it's somebody's birthday and you want to bring a flower. That's fine. But once we get into accepting large gifts of appreciation, it becomes very uncomfortable and everybody feels a need to reciprocate. If a hospice family wants to give you money, that can be a little uncomfortable. It does happen sometimes that they'll offer, and you can say, one, you're not allowed as a staff, as a member of the hospice team, and then say, but a wonderful way to give back to hospice is to donate to visiting nurses so we can provide care for everybody. Trying not to become overly involved in private family matters, and don't try to solve their problems. Don't try to fix it. You can't. Boundaries, questions you may have. We've kind of touched on this. You're welcome to read it. What if the hospice family asks more of me than I can do or want to give? Again, letting them know to call the volunteer coordinator or let the volunteer coordinator know what's going on. About giving your phone number, just be careful. There are occasions where you are meeting families and you are quite you know that they're going to keep their boundaries, and they just want your phone number so they can call you if it's too snowy or the road is muddy or a family member came in and they don't need you that week. That's okay. That happens. But just maybe not from the get-go. Don't be sharing your phone number. Take a little time to get to know them first. And like I said, yes, you can bring a little treat, a little card. Just don't get into large gifts and endless giving. And in terms of funeral services or sending condolence cards, we do leave that up to the volunteer. It really depends on how well you've connected with the family and how long you've served them. Sometimes it may seem pretty unnecessary. As a hospice staff, we always send a condolence card. But if you've known them for a while and wish to send a card or attend the funeral services, you are welcome to do so. Things don't go as planned. The hospice staff to explain your role, but we can't always control, what they're going to ask of you once you're present. Situations can change rapidly, so sometimes you'll arrive and things aren't quite what you expected. If this is really a problem, you need to let me know. But examples might be you're scheduled to go at a certain time, and then the patient declines overnight. Nobody told you that they don't need you there, or family has arrived and your service is no longer needed for that day, and someone forgot to call and cancel. Maybe you're providing respite at the nursing home, and then you come and the wife or the caregiver says, oh, we don't need you now. They're declining. I've changed my mind. These things happen. The patient, typically when a patient dies, you get an email or a phone call to let you know, but occasionally we can't reach you in time, and you're making a visit just on the edge of that passing, and just to have, your best manners in place. It's okay. Just let them know you must have not gotten the message. But typically we try to be pretty clear about what's going on with your patient, but there just are times when things don't work out. And if that happens regularly, and people aren't fulfilling their promises, then you need to let me know so we can reassess the situation. Safety tips. We kind of went through this in the volunteer info session that you got first for your training. So just eyeball that again. Make sure just to be aware of your own safety. And remind you again, in an in-home setting, if you really do feel unsafe, to remove yourself from the situation. Step outside the house and call hospice. Go ahead and read through these again. You should have been aware of them in the hospice volunteer training portion. So it's always good to do a little self-reflection. You need to think about what kind of situations you would have a difficult time with. Typically in your interview as a volunteer coordinator, I will ask you that, but there are things that come up that I wouldn't have thought about. For instance, examples might be the patient drinks alcohol throughout the day. We may have somebody with liver cancer and cirrhosis of the liver who is still drinking. We don't make them stop. We may suggest so, but it is their choice. We have patients occasionally that'll smoke marijuana, not typically in front of anybody, but you may smell the residue of that. We have patients who don't believe in God. You have very dirty homes, and you have patients who may have many animals, some of which can be rather loud. And will leave you covered in fur. So these are kind of little examples you might want to think about. And then next, we're just going to have a little boundaries quiz. It's pretty quick. We'll just go through this together, obviously, because we're not together physically right now. Never, sometimes, always. Bringing gifts and treats, as we talked about. Sometimes that's fine. Just be thoughtful about it. Accepting a patient's request for financial help, never. Accepting money or gifts of appreciation, pretty much never. Occasionally, there's a gift of appreciation you just feel like you have to take, and that's okay. Never invite your patient or family to your home, certainly not during service. And if you become friends with a family member, if you want to maintain that friendship, that's fine. But take a little breather post service of that family member before you start making contact with that the new friend you may have made. Don't offer unsolicited advice about patient care. This would be medicines that they should use, whether they should get a hospital bed or special equipment, or who they should see as a counselor. If you have special concerns, let the volunteer coordinator know, and I will get in touch with the social worker. Typically, they're following up on these things already, as well as the nurse, but there may be something special you witness that needs to be brought up. Don't date a patient or a family member, obviously. Don't discuss your personal life. There's going to be times when you're having a normal conversation and you're talking with each other about your lives, but this is not a chance for you to use them as your counseling service. So don't go on and on about you and your life and what's going on and the problems you're having. That makes the whole visit rather awkward. You're not supposed to be giving a lot of your personal contact information. Touching and huggings, that's fine sometimes, but just touch base with them first. Make sure they're comfortable with that. You may be a very huggy person, and that's wonderful, but not for somebody who doesn't like hugs. So feel that out before you launch on in there and giving them a hug. Again, not giving them what you think of as professional advice. You may be a nurse or a retired nurse or retired social worker or counselor. You need to do your best to put that role aside and realize you are playing the role of a volunteer and not to offer your professional advice. In the very beginning, don't be accepting lunch or dinner invitations from the patient and family. Again, if post-death you maintain a friendship with somebody from the family and that happens, I think that's okay. But in general, that's crossing a boundary. Attend a patient's funeral, of course you can. And like I said, maintaining a friendship post when somebody has passed, we believe is okay. Just to be careful not to become somebody's counselor in bereavement. Care concerns, abuse and neglect. These are just typical care concerns you might witness. Some will make you more or less uncomfortable. Typically, the caregivers are taking care of their loved ones in home are very good at it. I mean, it's a frustrating and difficult job, but they weather it well. But this is kind of letting you know some of the situations you might witness, and to also remind you that while you're witnessing it, so are all our hospice staff members. And certainly there are going to be times when we may have to report to the authorities regarding abuse and neglect, but we try to keep that situation intact as long as possible and provide as many supports as possible so that we do not have to do that. Typical care concerns. You're going to see somebody who's doing insufficient care. They don't have the right skills. They're not providing the right kind of care. They're not there long enough. They're leaving the patient unattended for long periods of time. The home is very unhealthy, unclean. It may smell. They aren't cleaning the patient as often as they should. They may be a little rough with the patient. They may say mean things. They're not as kind and thoughtful as you would be perhaps with your own family member. Sometimes the caregiver is stuck in this job. They never wanted to do it, and yet nobody else did. So they're going to feel pretty angry, and they're not going to want to do it. And they let you know, and you can kind of sense that in the way that they care for the patient. Sometimes if the patient is eating, they're not fed enough. They're not given healthy foods. I knew a patient who the husband would go and just get her a McDonald's hamburger every day. So, I mean, from my perspective, that doesn't seem like enough. It seems a little bit of a care concern, but it hadn't reached that stage of being some kind of neglect. Again, the patient's not cleaned or turned or toileted often enough, and just poor hygienic care on both the caregiver's part and for the patient. So these are some basic elder abuse or neglect situations. These should definitely raise a red flag. Obviously, physical abuse. We have nursing going in there pretty often and looking for bruising and other things like that. But if you see someone slapping or restraining or being very physical with a patient, you need to let me know. Obviously, sexual abuse. Usually it's a nurse who might be able to see that kind of thing. Sometimes you might have patients who have a dementia and they'll talk about somebody hurting them or beating them or abusing them. Don't instantly believe that it's true. Don't not believe that it's true, but just be careful, check in. Sometimes that's just the illness of the mind coming through and nothing actually is happening. Neglect, obviously not taking care of their basic needs, exploiting them for their money, trying to steal their homes, their Medicaid, their medicines sometimes, things of that sort, emotional abuse, abandonment. Obviously, occasionally we have people that just are not there long enough taking care of their loved one, and it's a dangerous situation. And then sometimes, believe it or not, it is the patient who neglects themselves, and that one can be difficult because they will not perform the essential things required to help them feel comfortable. Here's some basic what to do's. Physical abuse. If a male caregiver is frustrated with his bedfast wife and he's rough with her when changing her briefs, maybe the hospice staff has witnessed rough handling, but there's no bruises noted. That would be a situation where we would already be in touch with the authorities if it was obvious that this was happening, or the nursing staff would be constantly trying to re-educate the caregiver. Sexual abuse, neglect, exploitation, abandonment. I'll let you read these, and then I have on the next slide a few ideas of what you might do as a volunteer if you witnessed any of these. Well, we may or may not be able to record over my guffaw earlier, and if not, just have good humor and let's move on. Basically, in all of those situations, you would mostly let me know and just be aware, and then we will put hospice staff on it. And like I said, typically we are already aware of those situations and working our best to provide ample education. We will oftentimes try to get more volunteers in the home, more health aides, just more staff coming in general to kind of keep a cap on that turning really bad. So just know, have faith that we are aware of the situation, but certainly let us know if you have concerns. And again, here's our elder abuse hotlines. There's probably rarely a need that you might have to call those, but if you feel the situation warrants it at the time, you certainly can call in.